We're going to keep moving here and move on to the last paper of this section. Again, a collaborative paper across national borders. We have investigators that represent Yale School of Medicine, the Tokyo University School of Medicine, Tokyo Medical University, as well as the VA system there in Connecticut. And the title of this paper is Altered Hemodynamics During Arteriovenous Fistula Remodeling Leads to Reduced Fistula Patency in Female Mice. This is senior author is our editor-in-chief for this journal is Dr. Alan Dardick, and this will be presented by Arash Fereydooni. I hope I got that pretty close.
Thank you very much for the introduction and the opportunity to present our work. End-stage renal disease affects over 500,000 Americans, and almost half of those are women. AVF remains the most common access created for hemodialysis and the preferred modality with demonstrated superior long-term outcomes when compared to arteriovenous grafts. Multiple studies have identified the female sex as a factor that is associated with AVF failure and demonstrated higher AVF failure rate in women and reduced fistula adequacy for dialysis in female patients. Before an AVF can be used, it needs to mature. This maturation process involves wall thickening and aorta remodeling. However, in 1/3 of the cases within the first year, this maturation process can fail due to lack of aorta remodeling or development of new intimal hyperplasia later on. To study fistula remodeling, we have established a mouse aortic cable fistula model that recapitulates human fistula maturation and failure, in that around 1/3 of these fistula will fail after day 28. So we use our animal model in both female and male age-matched mice to test the hypothesis that female mice have worse AVF patency compared to male mice due to sex-specific differences in hemodynamics. In this model, AVF in male and female showed similar rate of dilation as well as similar rate of wall thickening during the early remodeling phase. However, female mice showed reduced AVF patency by day 42, very similar to the reduced AVF patency that we see in female humans. So these observations all together suggest that male and female mice have similar maturation and structural changes early on. We next looked at the differences in hemodynamic changes during AVF remodeling. We saw that on post-operative days 3 and 7, female mice had significantly lower mean velocity, and there was also reduced laminar shear stress in the IVC during the early AVF remodeling in female mice when compared to male mice. Because of these reduced hemodynamic changes that we observed in female mice, we next looked at the downstream signaling. We specifically looked at KLF2 and ENOS, which have increased activity with laminar shear stress and carry anti-inflammatory properties. We saw that the baseline number of mRNA transcripts for KLF2 and ENOS increased after early AVF remodeling in male mice, but not in the female mice. Similarly, we looked at protein expression of KLF2 and ENOS, and we saw that those increased in the AVF of only male mice, but not in the female mice. We also performed a proteomic-based comparison of the AVF between female and male mice, and we saw that the IVC of male mice overexpressed proteins that belong to pathways that are implicated in thrombosis. So all these findings together suggest that early AVF remodeling in female mice is associated with lack of increased transcription and translation of several proteins that are associated with anti-inflammation, laminar flow response, and thrombotic processes. To summarize, female mice have similar AVF maturation, but reduced patency. Female mice have lower AVF velocity and reduced magnitudes of laminar shear stress during remodeling. And consequently, they have less expression of early response proteins that are involved in laminar flow, inflammation, proliferation, and thrombosis response. To conclude, these findings suggest that hemodynamic changes that happen during fistula maturation may play an important role underlying the diminished rates of AVF utilization in female patients. Therefore, it is important to identify downstream targets involving these mechanisms so that we can improve AVF outcomes in female patients. I'd like to thank our funding agencies, my lab mates, and Dr. Dardick for his mentorship, and I'd be happy to answer any questions.
Excellent. Thank you so much. This was another very good presentation. First question from Dr. Eden: what happened on the arterial side with regard to flow, or were the changes in the arterial inflow also analyzed?
That's a great question. We did not see any significant differences in the arterial side during the maturation process. However, early on, around day 3, we did see a significant increase in the flow and laminar shear stress in the aorta, but during days 7 and 21, that response was not observed.
Excellent. Next question is, were the female rats proestrus, or were their ovaries removed?
These were young mice that were premenopausal. So and that is actually a limitation of the study, in that in clinical practice, patients who receive AVF access are patients who are most likely postmenopausal. And the animal model that we use here are young mice that are premenopausal, and we did not use a oophorectomy model. So they still had high levels of estrogen circulating.
Excellent. There's more questions coming. I'm going to go ahead and let you respond to maybe some of those in the chat if you'd like, so we can keep the talk moving. We've got more exciting stuff to come. I'm going to pass the baton back to Dr. Dardick. Thank you so much, everybody.
Thank you.
Thank you very much, Dr. Kirchie.